Hi, this is Dr. Justin here. Today's talk is going to be on PMS, Premenstrual Syndrome. So again, what is PMS? I mean, a lot of women are probably very familiar with it, whether it be causing headaches, cramping, abnormal blood flow, breast tenderness, you name it, I've seen it. So why does this occur in some women, not others, and what's actually happening, and what can you do to actually help address some of that issue? All right, so here's how it looks. So what we're going to do is I'm going to pull up my chalkboard here. It's probably the best way to get this complex information across. Make sure you can see that. All right, perfect. So the blue is going to symbolize estrogen. All right, I'm going to draw out a cycle. The average female cycle is 28 days. Here's the halfway point right here. Okay, so what you see in the first half of the cycle, you're going to see a lot of estrogen in that first half of the cycle. Boom, a nice drop, and then it kind of comes back a little bit in the second half. So the first half, this is your estrogen-based part of it. Okay, I want to write an E right there. All right, in your second half of the cycle, green is going to be progesterone. I'm going to put a nice little P there so you can see it. What you're going to see is a nice low dose of progesterone in the beginning. Then it's going to come right up, and then a nice crash at the bottom there. Okay, and then you're going to see the second half of your cycle is predominated with progesterone. So estrogen, okay, it's going to really happen in the first half. Why is that? Well, what estrogen is doing is, here's your uterine lining, like so. It's thickening that uterine lining up nicely. And then what happens in the second half of the cycle with that nice thick uterine lining, you get the egg right there so it can stay. Just like that. Perfect. So important to note, this middle area right here, this is where ovulation occurs. So kind of the intermediary between the estrogen and the progesterone, that's where ovulation occurs. So I just think it's really important that you actually know what's going on in your cycle, because then when I kind of finish up with the last half, everything kind of makes sense a little bit more. So again, we see here this drop, where the progesterone drops in that second half. This is where menstruation occurs. This is where you actually have your period. So what we find is the majority of women that have PMS symptoms, the breast tenderness, the cramping, the whole 9 yards, their progesterone is actually much lower. So imagine this line is much lower. So when we have low amounts of progesterone in that second half of the cycle, that's going to trigger a lot of the symptoms that we're referring to. Okay. So you're probably thinking, what's causing this low progesterone? All right. So I'm going to draw up here progesterone. Well, the question is, where's the progesterone going? Well, the progesterone is actually getting converted into a hormone called cortisol. Okay? You guys have probably heard of that hormone before. Cortisol essentially is a glucocorticosteroid. All right, so glucose. All right, blood sugar stability is one of the main roles of cortisol. Steroid, again, inflammation, pain. Right. Okay, so what are the most common things that drive low progesterone in the second half of the cycle is blood sugar issues. Not eating enough high-quality fat and protein. It's very important. Inflammation and pain. This could be chronic back pain, knee pain, neck pain. This could be from too much, too little exercise. This could also be from food allergens. This could also be from infections. There's really no magic bullet to PMS. There's no magic pill for it, because it could be a combination of these issues. But what we do here is we actually address the adrenal glands, because the adrenals are really responsible for producing cortisol as well as progesterone. So if we can address the adrenal glands, we have a huge impact in balancing this last half of the cycle here. And we also have a huge impact of addressing lifestyle concerns such as blood sugar, exercise, lifestyle, diet, and things like that. We also use some specific herbal blends and even adrenal support to actually help balance this last half of the cycle out. If you have any more questions, please shoot me an email or schedule the consultation and we can go a little bit deeper into your concerns. Thanks.